Okay, so today I'm going to talk about my project, which is making the case for promoting active mobility in times of crisis. And I will be reviewing effective implementation of active mobility in cities around the world, or why governments around the world, particularly developing countries, should include active mobility in times of crisis. I wrote this paper in conjunction with my internship with the ICSC, the Institute for Climate and Sustainable Cities in Manila, where I was supposed to spend a summer but could not due to the coronavirus. I wrote this paper as part of a remote internship. Okay, Oop, next slide. Firstly, what is active mobility? I define it as walking, cycling, and using personal mobility devices as a means of transportation. In this paper, I will focus on cycling and shared bike systems. Next, what is a crisis? I'm looking at three kinds: resource disruption based, like the 1973 OPEC oil crisis, when the oil embargo meant skyrocketing costs of oil on consumers and structural challenges to the stability of national economies. Secondly, I look at natural disasters, tsunamis, and earthquakes like the 2011 Tokyo earthquakes. And finally, I look at the biggest public health crisis of the decade so far, COVID-19. So, why should you care? Toxic emissions from passenger cars alone accounted for 14% of global greenhouse gas emissions in 2015, with the US responsible for one quarter of that figure, according to a UN report. In other words, our cartropolis are killing us. Aside from the Cold War and nukes, we're really coming close to that midnight hour on the doomsday clock, which you can see here. Because of climate change due to our lifestyles. If that doesn't convince you, vibrant mobility ecosystems are vital to cities' economic recovery. Less congestion means faster travel times and reduced costs. So I ground my work based on the thinking of two prominent urban planners: Jane Jacobs, who was an American-Canadian activist who influenced urban studies, and Benji de la Peña, who is an urban planner from the Philippines. Jane Jacobs once said, "There is a quality even meaner than outright ugliness or disorder, and this meaner quality is the dishonest mask of pretended order, achieved by ignoring or suppressing the real order that is struggling to exist and to be served." In a similar vein, Benji de la Peña said, "We've been planning our cities around the dimensions of cars. What we have known for 5,000 years is that cities are for people. So we need to get it back to the dimension of the people. And active mobility brings agency back to the people. Essentially, for the people, by the people. And we want to keep urban planning centered around people's needs rather than cars." I looked at case studies that would be reflective of this in developing and developed countries, countries in Asia, and countries that had more established biking systems. So I've listed them here, and this is Amsterdam. For my research purposes, I had to get innovative as there wasn't an abundance of academic literature on active mobility in times of crisis when I was writing it last year, because obviously the COVID pandemic was very new and there hadn't been a lot of literature around this. So for the more recent crises, such as the 2011 Tokyo earthquake and the 2020 COVID-19 pandemic, I looked at websites of think tanks, blog posts people had made, Facebook groups created by active citizens, and even Twitter accounts on emerging bike lanes, newspaper articles on the digital sites of many traditional newspapers were actually very helpful to me in establishing timelines, and where I could obtain them finally, academic articles to flesh out my findings. So in my research, I found that cycling during crises enabled a much more flexible response. For one, you can get home much faster on a bike than a car in the event that roads are blocked by rubble. It's cost effective, you're not reliant on public transport should railways buckle due to earthquakes. If, like in Manila during the pandemic, public transport is shut down, frontliners are still able to get to work faster than walking. You can even conduct more efficient rescue missions if you're trying to help earthquake victims trapped under the rubble, since cars are quite noisy and can obscure cries for help. In a post-pandemic world, it's the perfect model for social distancing. In a natural resource-inspired crisis, such as the OPEC 1973 oil crisis that hit most of the world, you are not reliant on gas-guzzling cars. Even after the crisis, active mobility systems such as bike lanes have lasting benefits. They're not expensive to create, and the benefits in terms of climate protection are immense. Building traffic calming roads means everyone benefits. Building infrastructure is Keynesian economics 101. Big spending means more jobs, means a better economy. There's also the cross-sectional engagement of society, which promotes a reduction of social inequalities, as well as the taking back of public spaces for the citizenry of a country. As a nation-building tool, this promotes social cohesion and serves as a tool for educating people about the history and architecture of a place, such as was implemented in Bogota in Colombia. Before we can recommend such schemes, it is good practice to analyze the ingredients that allowed successful implementation of active mobility. In summary, an active grassroots movement that convinces the voting masses, having voices in politics strongly support the cause, extensive knowledge of the linkages between existing transport ecosystems, as well as promoting multimodal urban planning is key. Multimodality is simply a trip with multiple transport modes, which requires them to be coordinated, such as bikes, trains, and bus stations. A connected route is a convenient one, and we all know that people use things that are quite simply easy to use. So we must also look at challenges and why certain cities face certain challenges when it comes to implementing active mobility strategies and specifically cycling infrastructure. The problem of cars being viewed as a status symbol for the wealthy inhibits those rising to the middle class from taking what they see as the poor man's way of getting to work, also known as the humble bicycle. In my research, I discovered this attitude is especially pronounced in Manila. And furthermore, women across cities feared for their safety when cycling out in public, even in more economically developed cities, has been a problem since time immemorial. And other inhibiting factors include inconvenience of bicycle routes due to a lack of interconnectedness to other forms of transport, the inconvenience of cycling in business attire, and arriving to work drenched in sweat. Finally, there exists a gap in the desire to implement active mobility, especially biking infrastructure in urban planning, and the actual funding allocated for it. In Latin America, 60% of mobility investments are concentrated on projects for private vehicles, so usually cars, and it remains comparatively low. In conclusion, urban planning needs to return to the principle of people first, and the COVID-19 crisis most recently has shown us why and how a holistic cycling infrastructure can bring social, physical, and economic benefits to cities that implement them. I recommend a plan that emphasizes extensive bike lanes that are multimodal in nature and have sheltered elements to prevent harassment and accidents on the road. Eventually, I do want to expand this paper into a more wide-ranging analysis of the feasibility of applying active mobility precepts to the cities in both South and Southeast Asia and hopefully getting it published in a journal with my advisor. After all, no ancient poet ever composed an epic talking about his version of the car, the donkey cart, but of the vibrance of Athens and Damascus, and let us do the same. Thank you.